Geriatricians serve a very unique role when it comes to the care of older adults. They're the specialists. They're internists or they're family practitioners, but they specialize in caring for adults, usually over age 55 or 60. And that's because adults at that age start having different kinds of health problems than a 30-year-old or a 25-year-old or a 45-year-old might have. And they understand how to manage not only issues of Alzheimer's or dementia, but other chronic diseases that are very common to older adults. Often people with Alzheimer's have several other chronic diseases that they're juggling at the same time. So they can manage this almost as a package, if you will. They understand the physiological processes of the older body, which is different. For example, older adults metabolize drugs differently. Their nutritional needs are different. So working with a specialist in that sense, they're still a clinician, they're still a doctor or a nurse practitioner, but they've had these years of extra training in managing the health of older adults. Chances are they'll also be more in tune with the needs of Alzheimer's patients, with the needs of the caregivers, and be more willing to discuss and refer to whether it's other specialists, to a social worker, or to a support group, or to a nonprofit that might be able to help the caregiver through this process. I think overall a geriatrician might have just a better holistic understanding. Neurologists are, again, those are real specialists. They deal with the brain. And Alzheimer's is a brain disease. Things happen, things matter. And the reason you would see a neurologist is because you also want to rule out other potential diseases. There may be other diseases that can mimic Alzheimer's. There may be other diseases that can be treated. For example, sometimes people might get Parkinson's disease, or might develop Parkinson's disease, I should say. Some of the signs and symptoms can be similar. Sometimes Alzheimer's and Parkinson's disease go hand in hand. Neurologists are specifically trained to treat disorders of the brain. And they can help you understand the processes of what happens when the brain starts breaking down. What is Alzheimer's, what might be the Parkinson's, or what might be something else. You want to go to them to make sure that other things like stroke are ruled out, or brain tumors or anything like that. And they can really help with your big picture understanding of the whole process. Geriatric psychiatrists really play a unique role in this whole process. Older people often suffer from issues like social isolation and depression anyway, particularly as their friends start dying off or they develop more chronic illness, their mobility gets limited. Things just aren't as they used to be. Their bodies aren't responding the way they want them to. When you tack on a disease like Alzheimer's on top of it, there are high rates of depression. There are high rates of behaviors that are related to the disease, but also behaviors that are not related to the disease, that are just related to aging. And geriatric psychiatrists can help both the person with Alzheimer's cope with some of these issues that they're dealing with, like the social isolation or the depression of the diagnosis. But they can also help the caregiver learn how to manage and deal with the behavioral changes that come with the disease. Many people find nurse practitioners preferable to the traditional doctor or clinician for a number of reasons. And the one that keeps coming up over and over again is that they're better communicators. Nurses in general tend to be better communicators than doctors are. Perhaps it's because they're less harried. perhaps because there's less time pressure on them in some cases. But I think in general it goes to the different kinds of training they receive as they go through their clinical education. And nurse model is very patient-centered and patient-focused. They're the patient advocate. Physician model is clinical-centered, so they're more treatment-focused. They look at the disease, whereas instead of the person, whereas nurses tend to look at the person first and then the disease. A friend of mine got her mother in to see the only nurse practitioner within a 45-minute drive of where her mom lived in Florida, because she wanted the better communication. One of the things her mother had complained about as the Alzheimer's disease progressed was that her physician wasn't taking time to listen to her, wasn't taking time to talk to her enough. So through a lot of phone calls and working with a care manager, they were able to find a nurse practitioner that specifically dealt with older adults and had experience with Alzheimer's patients. And even though it was a huge burden for her mother to travel 45 minutes to go see this person, it made for a much better clinical relationship. Her mom felt listened to, her mom felt understood, and importantly, her mom had better compliance with the regime, taking medications and taking care of herself, because she felt like this person almost could be a friend. Nurse practitioners kind of take on a dual role. They're clinicians, but they're also a support person. And many people find they create a closer bond with their nurse practitioner than they do with their physician. It works for some people, but on the other hand, others will say, well, you know, I'm paying to see a doctor, I only want to see a doctor. And again, we go back to the whole scope of practice issue, given the variables within the 50 states. Some states, nurse practitioners can prescribe and they can treat and they can do almost everything a clinician does to a point. Other states, nurse practitioners are very limited in what they can do. For example, can only operate under a physician's direct supervision. So it becomes very confusing, and again, it really boils down to what state are you in and what are the laws within that particular state. If you happen to be in a state where nurse practitioners have a broad scope, then very often they can substitute for the clinician, for the physician. In other states, it may be as an adjunct. You may see the nurse practitioner for standard care, weight measurement, medication reconciliation, but the physician may still have to do the traditional visit. Geriatric nurses are nurses that specialize in the care of older adults. And you can liken it to a pediatric nurse or a rehab nurse or any of the other specialty areas of nursing. Geriatric nurses tend to work either in hospitals or they might work for a home care company. And they really enjoy caring for older adults, and that's where the extra training comes in. Nurses in those situations, usually, again, depending on scope of practice, but nurses in those situations have to work under physician or hospital supervision, or perhaps might work under the supervision of a nurse manager at a home care company. But if somebody's taking care of your loved one, again, you really want somebody with experience with older people or with experience with Alzheimer's, because they just can relate to the patient better. They understand some of the behavioral issues that come with it. And importantly, they understand a lot of the needs, and they can build relationships and really give that person a better quality of care. Therapists play a very interesting role. There's occupational, there's speech, and there's physical therapists that can get involved in Alzheimer's disease, both for the patient and the family. Physical therapists can teach compensatory skills. For example, if the Alzheimer's patient is having a problem walking, for whatever it is, age-related mobility issues, They can teach them compensatory skills, for example, how to use a walker to get around more safely. An occupational therapist might work with the patient or the family caregiver to do things like label the drawers to let them know where the forks, knives, and spoons go, or where the plates go. Or they might look around the house or the apartment and suggest getting rid of things like scatter rugs, which can be a fall hazard. Occupational therapists teach people how to work within their environment safely. Physical therapists focus on the mobility or the lack of mobility issues. So for example, physical therapists might suggest putting a ramp in the front of the house instead of having mom or dad negotiate steps. Or they might suggest modifications to the home where if the steps are a hazard, perhaps you might want to convert a first floor room, a den perhaps, into a bedroom, which just keeps the environment a little bit safer and avoids some of these potential fall hazards. Speech therapists really work on communication and can teach both the patient and the caregiver more effective ways to communicate. For example, maybe you don't ask mom, what would you like for dinner? But rather give them a choice. Would you like chicken or fish? And it allows the person with the disease to maintain some modicum of independence, but it creates much less of a barrier to getting the answers. So all three have an important role to play, and I think more caregivers can tap into that. Again, the various trade associations, professional associations that these therapists belong to can point you to people in the local vicinity that can come in and do a consult or can just talk it through with you over the phone. Care managers and social workers can also put caregivers in touch with therapists and have them come in and do something like a home assessment. The geriatric social workers are specially trained to care for the needs of older adults. They're the ones that can tap into the programs, for example, that know about those grassroots programs designed specifically for people with Alzheimer's or their families. They're the ones that can help you cut through some of that bureaucratic red tape when you're trying to get mom qualified for Medicaid, for example, because they deal with it day in and day out. They know who to call. They know the supports that are available locally. They know what the patients and the families are going through because they live it and they deal with it every day. Research, of course, plays a big key. Communication with your care team is vital, but I think that there's a lot people can do. For example, the Alzheimer's Association has a newsletter that you can sign up for. Or you can sign up if you join a support group. Many of them offer their own newsletters or discussion boards, that sort of thing. I think the best way to stay informed is to keep the lines of communication open. And whether that's online or in person or through one of your care team members or all of your care team members, it boils down to communication.